Welcome to Grad Chat by PhD Balance, where we talk about topics of grad school beyond academic research. I'm your host, Courtney Applewhite. My pronouns are she, her, and hers, and I'm a newly minted PhD from the University of California, Santa Barbara. Quick reminder to subscribe to Grad Chat on your chosen platform to get notifications about new episodes. And if you're in the mood, please leave us a rating or review. It really helps people find the show and us to reach other grad students. Our topic today is mentorship and therapy speak with Eloïse Fairbank. Eloïse, pronouns she, her, is a PhD candidate in the clinical psychology program at Concordia University in Montreal, Canada. Her research focuses on the relations between social support, subjective social status, and child health. Clinically, Eloïse works with children and adolescents and has a specific interest in the treatment of trauma-related disorders. Throughout her graduate studies, Eloïse has been involved in a number of student-led initiatives about mentorship and student mental health. During her free time now, Eloïse enjoys extreme sports and improv. We're so pleased to have you on the show. Welcome to Grad Chat, Eloïse.
Hi, thank you so much for having me. I'm excited to be here.
Yeah, and also full disclosure, Eloïse works on the PhD Balance team. She's one of the speaking team members. Is that right? Yeah, excellent. So we're really excited to have you on the show and talk more about this. And one of the things that I noted from your bio is that you have a lot of career interests or like intersecting interests. So how do you fit together your research and the clinical work that you're doing and mentoring and sort of all these roles that you have in graduate school?
That's a great question. I think like the overarching interest is probably connection with others. And I think that really helps kind of focus my research interests as well as my work with clients. And I think mentorship is a huge part of that, especially as a student. We're looking for mentorship from our supervisors, both research supervisors as well as clinical supervisors. And I think as graduate students as well, we can be mentors for other students. So it all kind of comes together, I think, to, kind of just bring it all together.
Yeah, and I think that one of the things that I really like about graduate school, or I really have liked about it, is it is a space where you can kind of bring together those different roles. Do you think is it typical in your field or whenever you're thinking about your future career for those things to intersect, continue to intersect, or do you have to kind of fight to make space for all of those roles that you have now?
Yeah, I think completing like the PhD in psychology, you have a lot of doors that are going to be open to you because you have that research background as well as the clinical training. So I think a lot of people like to explore that flexibility in terms of what you can do in one position. So for example, you might work in a public sector and you're doing program evaluation and research as well as seeing clients and supervising graduate students, for example, versus working in private and like running your own business and seeing clients full time. And maybe you're teaching a course here and there at the university. So I think it really depends on, what your interests are. I happen to be interested in everything right now, so I'm going to see how it goes. But I think it's great in terms of the training. We're kind of set to do anything that we want to explore.
Yeah, and so you said you're kind of in all of those camps right now. Do you have any sense of what you want to do next, or how this is orienting you towards your future career?
Yeah, that answer I feel like changes throughout the PhD. But I think for now, I love therapy. I love individual work. So doing that, whether it's in public or private settings, is I think the priority. I also have an interest in, the mentorship piece, whether it's teaching or supervision. I think, being part of the training for newer psychologists is something I'm really interested in. And again, kind of weaving in that student mental health piece. And maybe if I'm not too busy with all of that, being involved in more public health related or public health level consultation. I think that, again, talking about student mental health, it's very, when we're working with individuals, we're really working one-on-one, but that doesn't necessarily help contribute to solving more systemic issues, I think. And so the public policy level things like building new interventions that you can make in schools or consulting with different organizations can be a great way to work above and beyond the individual level and work with groups and communities and whatever municipality you're with.
Yeah, I think that having those different, I like psychology for that in the way that you're describing it, because it sounds like there are so many different levels that you can really clearly apply your work. And so do you find that the research that you're doing now informs some of the ways you interact on like an individual clinical level and informs the way you think about public policy, or how do those things intersect in your mind or the way that you sort of view them?
Mm-hmm. I think it's a complicated answer, a little bit of yes and a little bit of no. Like, so my research right now, I'm really looking at social support and child health with like a myriad of other factors that we're, adding into those equations. And I think that in and of itself relates to therapy, because therapy is about supporting others and trying to build their own interpersonal network to help them with whatever your clients are struggling through. So I think in that sense, it is helpful. But some of the theoretical pieces of my research, like what is the definition of social support and how does this relate to like biomarkers of physical health, I think is less applicable. But I think in general, the takeaways being, if at a population level, the more social support kids have, the healthier they are. That's a really interesting finding to bring into the therapy room, to be like, hey, like what I'm doing with you is evidence-based above and beyond whatever therapy. It's actually going to be good for you down the road.
Yeah, and so I know that you've set up a few of these, like an organization that supports mental health for graduate students and undergrads in psych in particular. It is that sort of, did that come from this research base of the knowledge that social support is so important for adolescents, in your case, for examples for children in your research, but perhaps more widely applicable to people in psych, for example?
Yeah. And I mean, social support across the board for adults, older adults, you have these, again, we use the word myriad of like positive outcomes that are associated to it, whether it's mental health or physical health, or like even like cool studies about immune health and how your immune system is stronger the more people you have in your network. But in relation to your question, did my kind of involvement with the mentorship come from that? I think in part, yeah. Maybe that wasn't the initial goal, but I think looking back, I'm like, yeah, that does make sense. Yeah, it was an interesting, I guess, story of how that happened, because I'd been attending a undergraduate like networking event where they invited graduate students to speak about their experiences and just network with other students in the program in psych. And I was like, wow, like this is crazy that there aren't other events like this, because you're being hounded by like dozens of undergrads who have so many questions and don't really feel they have like a place to necessarily ask graduate students these things. Again, maybe they don't have like the social support that they're looking for in terms of like instrumental support or really that advice that they want. And then it was about, hey, what if we created that space for these students? And part of that is also talking about the stress of applying to graduate school, the stress of being an undergrad, the stress of being an undergrad during COVID, and all of those things.
Yeah, I think that that's so important. And so the organization that you started at your university to speak to this, it was oriented towards psych undergraduates and psych graduate students specifically, right?
Yeah, exactly. So it's called the Mentorship Among Psychology Students, or like the MAPS committee. And so we are actually under the umbrella of the Association for Graduate Students in Psychology, which is pretty cool. So we get to work, side by side with the department. And I think, I mean, we're in psychology, so we're like, yeah, let's do it for our department. But I think it would be so applicable to like all the departments, because it's this piece about there being a gap, I think, of communication between undergrads and graduates is prevalent across all the departments as far as I can tell. And it's such a different world almost that, you have either you're an undergrad or you're in grad school, and that in-between part can be so isolating, I think, in a way.
Yeah, I definitely see that in our department as well. Like there's a disconnect between the graduate students and the undergrads, and some of that has to do with being in the humanities. It's a much smaller department, so it's sometimes it's a narrower pathway. I think there's probably more psych undergrads that might be interested in graduate school than religious studies undergrads that are interested in graduate school. It's a bit more niche, perhaps. But I think that your point stands, right? That there is this divide between the two that doesn't necessarily need to be there, and it's not necessarily productive for it to be there, right? Because the graduate students have this information that undergraduates might find important. Can you tell me a little bit more about the process that you went through to set up the organization? So you said it was kind of with the department, but if somebody wanted to set up something similarly, like what kind of steps did you take to do that?
Yeah, that's a great question. So it started off, I had a good friend and one of my mentors who was at that time the president of the Psychology Student Association that I mentioned. And so I had reached out to them and I was like, I have this idea and like, what are your thoughts? And like, what's your immediate feedback? Like, what do you think? What do you think could happen with this? Just to see like, okay, is this in my head? And like, is this an idea that might not be realistic? And just getting like really good, feedback, I think, first and foremost, before really building a concrete proposal, was very helpful. And then after that, I like wrote up a little proposal about rationale for such an organization and what the budget would look like and who's our target audience, what gap are we filling, all these things. And then I met with the chair of our department and pitched that. And then once we got the okay, it's kind of like a rolling experience, I guess, of trying to put everything together and getting a team together of execs and speaking with graduate students, speaking with undergrads. I think what was very helpful was speaking with organizations that were already, I guess, established, like the Concordia Undergrad Psychology Association and the Grad Association and like event planning organizations at our university. So getting kind of the support of others to get that going was incredibly helpful. And yeah, so I would say if anybody's interested in doing that, just talk about it with people and see what ideas you can get and how that contributes to whatever written proposal you want to make.
Yeah, I think that was a great initiative on your part. And I think that using the people in the department are like useful for that too, because, or like the other organizations that are tangential to that, to the goal that you had to create this sort of environment for both graduate students and undergraduates. I know, for example, in my department, we have like an undergraduate liaison that is a graduate student that's meant to sort of help facilitate these events for undergrad specifically. But if you have people like that in your department, like bringing them on board to create a bigger collaboration, I think might be really useful for step 2.
Yeah, exactly. My supervisor always tells me, she's like, don't reinvent the wheel. There's so much out there. Use it first. That's such good advice that I apply to so many things because you're probably not the first one to have such an idea. So there's going to be some steps you can take that other people have taken before.
Yeah, totally. And so what are the events that you have in your group, your MAPS group? What do they look like, and sort of what kind of events what space have you held for the people that are involved in them?
Yeah, so we have, I think, 2 main objectives. And I should say right now, I've taken a step back from chairing that as I have to finish my dissertation, but it's still really exciting to see it grow from the side. But the two main goals, I would say, one is mentorship. So we pair up undergraduate students to graduate students in the program. So year by year, it kind of depends how many students we had. I think the first year it was like groups of 5 to 8 mentees per graduate student. And then as the year has gone on, we have more of a process for, write a cover letter of why you want to be a mentee. And then people who end up writing the letter are much more engaged. So we have that mentorship sort of matching process. And then we have workshops throughout the year. And so the workshops are going to be like degree planning in psychology, how to apply to graduate school, how to apply to funding, how to manage your stress during exams. And we can work with, the student health center and have guest speakers come in. We talk about alternative degrees. If you don't want to do your master's in psychology, what else can you do? Like youth work, diplomas. We had med students come in and talk, physiotherapists. So kind of, I think, showing or helping to show students that there are so many options coming out of undergrad from psychology. I think one of our biggest events every year is we have a panel called Careers in Psychology, and it's all about jobs you can get just with your BA in psych. So I think, at least for me, I remember being an undergrad and being like, okay, you have to go to graduate school. That's how you're going to become a psychologist. If you're studying psychology, which luckily is what I wanted to do. But if that's not the case, there's still so many options. And yeah, so I would see that that's kind of our two pieces, the mentorship and the workshops. And then throughout, we really try to promote student mental health and the services at the university, and work with them to promote events and things that they're hosting.
Yeah, that sounds like such a valuable and important program. I think that's so cool that you were able to get that going, and now it's existing without you, which I think is the biggest hurdle of any sort of program that you create, right?
Yeah.
Then passing it on.
Yeah, it's my little baby.
Yeah,
like,
it's tough.
Yeah.
I think it's very, very cool. And so you sort of have that piece where you have this mentorship relationship with undergraduates and graduate students. Now, as somebody who works in a clinical setting and sort of has these additional burdens in addition to like just standard graduate school stuff of research and writing a dissertation, how do you find your supervisor, your peer groups? Do they offer support in some way for the additional burdens that come with both graduate school? Do you find that there's mentorship and support that goes upward as well, like to supervisors or amongst your peer group, in addition to that lower level that you see with undergraduate students?
Yeah, it's a great question. I think absolutely. I've been very lucky that, my cohort is like, we're all each other's biggest cheerleaders, and very, very much so like the social support is strong with colleagues and even people not in our year. I think within the program, there is an understanding that kind of we all have each other's backs, and when we're doing applications, we'll read things over for each other. And I'm very lucky in that sense. And I think for supervisors, of course, it'll be different for each supervisor and student in their own relationship, but I've been very lucky. I've been my supervisor for ever since like my honors thesis in undergrad, and I love her, so I decided to stay. And so I think in that sense it's great. We know each other very well, and she was a great source of support, especially during COVID when I was not doing a lot. So that was I would say it's great.
Yeah, that's excellent. And are there more like formal support groups or formal like settings like the MAPS program that you developed for the graduate undergraduate relationship at your university, where you can have graduate students supporting each other, or like a formal support group in that way?
That's a really good question. And there actually isn't. I think the closest thing to really a formal group would be maybe the student association. And sometimes they'll host, events, or they'll host, I think during COVID, we hosted like a peer support Sanka set on Zoom sort of thing. I think in clinical work, it's a little bit different in that you have like group supervision. And so you can, discuss your cases all together. And sometimes a part of that is discussing like a really difficult case that's personally hard for you to either conceptualize or, deal with the feelings that come up for you during those sessions. And I think that extends to beyond just university, but likely when you're a professional working and you're going to have those group supervisions, it's formal and informal way of really getting the support that you need when you're facing a challenge in the clinic.
Yeah, I honestly think like I certainly appreciate that when you're doing clinical work, that is a particular kind of burden. But I honestly think the idea of like having supervision groups is something that like if all graduate students or all advanced like degree people could benefit from.
Yeah, absolutely.
Like you're having a difficult time with a particular book or something, and just to discuss that in like a supervision group in like a safe space where you can like detail it, or even like if you're having a challenge with a supervisor, like to have that moment in the group to sort of like issues. I guess it's just like having friends, but maybe I'm like at a more professional level.
No, absolutely. I think so. And I think that's also, not only is that like working through, whatever challenge you're going through in the moment, but I think it's so important in terms of like prevention for, burnout or whatever else that we're going to be going through during the PhD. I think it's an important prevention sort of strategy that should be more formally supported at universities for sure.
Yeah. And with the topic of burnout, so because of these additional burdens that psychology PhDs who are also doing this clinical work are doing, do you see burnout affecting, your peers more than you see it affecting other graduate students? Do you think it's similar levels, but just different sort of impetuses behind it? Or how do you see burnout manifesting among your peer group?
Yeah, that's a great question. I think I can probably say it's more on an individual level than I could really generalize, like for our group specifically, or our cohort, or for psychology students specifically. But I think it's really about, yeah, being like aware of like, what is burnout, what does that look like, and what does it look like for you? And I think with clinical work, maybe there are times we might be at higher risk for burnout if we're dealing with, a really sensitive case or something that really brings up, like I said, emotions for us based on our past or something. And so I think in that case, there might be, you can take extra precautions to kind of make sure you're taking care of yourself. And I had a supervisor once who, in a clinical setting, who recommended that we have like a questionnaire. And there's so many like burnout questionnaires, caregiver burnout questionnaires. And so she recommended like every 3 months, do the questionnaire, see where you're at, and you can really like track it, which I love because I'm all about the objective like measurement stuff. And I'm like, that's great, and even talking about it more openly like that can be a huge, I think, can break down those barriers.
Yeah, that's not a bad takeaway just for graduate students in general. Maybe just having that longevity of like a questionnaire every semester's end or something, like where are we at on the burnout scale, for probably provide a lot of insight, I would think.
Yeah. So I think sometimes we're not even aware, and I think for myself, I look back during COVID and I'm like, in the moment, I was like, I'm fine. And now I look back and I'm like, oh man, I was definitely burned out. So it's, yeah, that kind of objective thing to look back on.
Yeah, no, that makes a lot of sense. I think that, we talk about burnout a lot sort of in the generic, but whenever you think about like I think I'm putting a lot on you. It's interesting now that I'm like reflecting on my own interview questions here because you're in psychology. So I actually going to back off from the question I was going to ask and ask, do you think that like you feel more beholden to your like being on top of self-care and being on top of burnout because you're also expected to be like a psychology expert, so like you're meant to be able to manage like your own, but or are you like more like the doctors who never go to the doctor type thing?
Yeah, that's so funny that you asked that. I was just talking about that with somebody the other day, and it I think for many of us there is that thing where our clients are like, you obviously have all your life together, like you're a therapist, you're giving us advice, like for sure. And it's like, no, we're literally just human like you, and we go through a lot of the similar struggles. We just don't tell you because that's not our role, And I think that's funny that you bring that up because, yeah, I think that's something that we also need to like unlearn. We don't have our stuff all put together just because we're in this profession. And yeah, that's.
And it doesn't make you, I mean, so you can still do the work of like listening and reflecting and everyone is, for example, I'm great. Like if somebody brings a relationship problem to me, I'm like, let's sit down, let's talk about it. I will like, but it's hard then to like, examine your own relationship and come up with the solutions in it. Right. So I think that you can be an excellent therapist or an excellent clinician and still have your own sort of challenges that you're working through. That makes total sense.
Yeah, absolutely. As long as you're aware of them and you have that clear role. And yeah, I think it's like any other profession, right? If you have like a doctor working in oncology and they have their own history of cancer, it's not like, well, it's not going to make them necessarily better or worse, but it's going to have their own personal relevance for whatever they're doing. And I think the same goes for therapy. And yeah,
that makes sense to me. Okay, I want to pivot a little bit because I want to talk about this other topic that we had talked about in like our pre-show notes, which was about, got to talk about TikTok. As somebody who's like very lightly on TikTok, because I know that it would be a huge problem for me, I just like to think about TikTok as a thing. But there's been what I've noted, I've seen a couple of articles about it, and we've talked about it before in talking about what we wanted to talk about today on the podcast. there's been this rise of like self-diagnosis on social media, particularly on TikTok, particularly around mental health concerns. Can you talk a little bit about that and what you're seeing and what you've observed with that?
Yeah, absolutely. And I think you're right. It is definitely a topic that's getting more traction. I just saw an article last week about it and I was like, oh, perfect. I'll pin that for the podcast. But in terms of self-diagnosis, I think there's both pros and cons to, I think, this like therapy talk and self-diagnosis that we're seeing on the rise. I think especially with young people, because I think the big takeaway for me in terms of pros is opening up the conversation and helping destigmatize a lot of these symptoms that we associate, I think, historically with shame or whatever else, because this Gen Z especially is a really, I think, brave and like kind of new, generation to openly talk about mental health so much, again, with like COVID being a huge part of that, I think. And so by opening up the conversation and decreasing the stigma, increasing our understanding, I think not only can, clients, let's say, or general population increase their understanding, it also gives an opportunity for professionals to use that platform to help educate. So that's kind of one piece of it. But I think, there are some cons to, I think, this rush to label things, where I think some information gets lost in translation because diagnosis is complex. And I mean, there's thoughts about whether diagnosis should even really be used all the time or not. But I think, you see all these videos of, I forgot my keys, I'm so ADHD, like, and it pathologizes like normal behavior, like fatigue or forgetfulness, right? And in some cases, when we're thinking about maybe disorders that have more serious consequences day to day for some people suffering, it can invalidate those symptoms for those who are really going through what they feel is very difficult. And I think this is really big with, like, for example, trauma or bipolar or personality disorders. And by self-diagnosing and labeling things, I feel it sometimes takes away from the conversation. It's like, okay, well, I'm not going to have to deal with explaining what this actually means because I'm going to be able to say, oh, well, this is my ADHD or this is my, narcissistic partner, rather than really digging, like, what does that mean for you? And I think I'm going on and on. I think if anything, like, what's important when we're having a conversation about this and we're not just, consuming all this content is being like, okay, well, do we have a shared language or a shared understanding of what this word means, what this diagnosis means to you? And are we really talking about a diagnosis or are we talking about a specific behavior that you're observing, which could actually be explained by a number of different things? So all to say, many pros and cons. And it is something that I think is coming up more and more in therapy room with, clients coming in and being like, I saw this TikTok and I think I have, this and that. And then you got to be like, okay, well, what does that actually mean for you? And what are some actual examples of what you're going through?
Do you find that it makes it harder whenever somebody brings a presumed diagnosis into the therapy space to you? Like they're like, I'm pretty sure I have ADHD because I saw this TikTok. Does that make it harder for you as a clinician, or how do you navigate that that assertion?
Yeah, I think that's a great question. So it might depend on the context. Like if they're coming in for an evaluation or more for therapy, if you're coming in for like a psycho evaluation for example, like the point is to figure out, kind of fill in the pieces of the puzzle, what's going on with me and like, how can I eventually help decrease my distress or whatever's going on. Versus therapy, you might have more space and more time to really deconstruct what's going on for that person. That's my little blurb of, it might depend on the context, but I think it could be an obstacle if all they want is really just a diagnosis. Like, this is my idea of what I have, and I would like you to confirm it for me, and that's all that I want. I think that can be an obstacle, and people are kind of more stubborn and well, I shouldn't say stubborn, but I think if that's really all they want, it could be an obstacle. But I think oftentimes, again, getting to that shared language, spending time discussing why would a diagnosis even be helpful for you? Or, what makes you think this? It's really about validating your client's struggles, right? And I think a lot of people just want to be heard and want to be taken seriously. And yeah, so I think it may make the diagnosis more difficult or not, but in the end of the day, I think it's a starting point to have that conversation about, what it is they're really going through, and also educating, I think, clients about how to consume that content on TikTok. And there was a study, I think I've written it down somewhere. It was published on CBC maybe, but they were talking about the amount of ADHD content on TikTok. And one study had looked at like a random sample, and 52% of the videos are misleading and like not actually accurate. And then once you fall into that, right, all the algorithms are pointing you back to the same sort of videos that you're watching. And so it's like a vicious cycle. And I think when we're in that cycle, we don't necessarily have the time to step away and be like, okay, actually, like this is really the algorithm leading me to really confirm what I already thought. And so I think talking about that also can be helpful, especially with younger clients.
Yeah, for sure. I think that the algorithm is both the like helpful and the enemy in some ways, right?
Yeah.
I think that you make a lot of good points there. So I think it's so important that we acknowledge the fact that mental health resources aren't available for everybody, right? So sometimes TikTok is the only source of information they have about like the kinds of mental health struggles it might be the first time they've even like seen their mental health struggle. I know that there's been a rise in diagnoses of like women with ADHD, for example, because for a long time women were underdiagnosed because they didn't have like the same kinds of symptoms as males present with, basically. And so for better or for worse, we're sort of seeing this rise of women who are like, I definitely identify with all these ADHD symptoms. And, but like that all to say, like, I think opening up the conversation is so important, and opening up the possibility like, oh, I saw this TikTok where I identified with some of these behaviors, and then bringing that to the therapy space is so important. But, for example, my husband is inundated with ADHD TikToks, and he does identify with some of the things on there. I was like, he has some of those characteristics, but then us being sort of like sciencey geek people, we sat him down with the questionnaire, like the official diagnosis questionnaire, yeah. And he didn't meet the criteria, right? Like, so we were like, okay, so they're just targeting you because you have a couple of like ADHD tendencies. I was like, but I mean, it's useful in the sense that you can still adjust behaviors. You mentioned this, right? Like, so like addressing the behaviors that these things are like, or that you can do in order to mitigate some of these like things that you might think of as maladaptive behaviors, basically, or it's behaviors you want to adjust. So I can totally see that there's again, just pros and cons.
Yeah, exactly. And I think what you're saying too is important. Like people really like seeing themselves in that contact, maybe for the first time, and building community, and go back to social support, but really getting that feel of like, hey, I'm not alone in this, and other people experience this as well. And even that can even be used in therapy, like intrusive thoughts, for example. People are like, oh my gosh, like I have these weird thoughts about like what happens if I do this, or and it's like there's so many funny intrusive thought videos on TikTok or Instagram or whatever, and you're like, see, this is normal. Everybody has. They don't necessarily mean anything. And so there's like we said, pros and cons. We could go all day.
Yeah, no, absolutely. But I mean, so coming back to sort of the education piece a little bit. So what is the best way for people to sort of approach these educational TikToks in the mental health space? So there's so many, right? Like, and so what is your advice to people who are, existing on these platforms, getting the algorithm is feeding them all this stuff about ADHD or depression or bipolar and stuff like that? How do you sort through that in a productive way if you resonate with some of the things that people are saying, for example?
Yeah, that's a great question. I think a great place to start is asking yourself, okay, where's this information coming from? Is this from someone in their house who's talking about their own personal experience? Is this from like a licensed mental health professional who's using their platform to share like maybe myths or common symptoms, things like that? And I think, again, like there is this huge potential, and many psychologists already do use social media to educate. And so following, I think more evidence-based or like sciencey sort of psychology accounts, I think can be helpful in that sense, in that you know the information you're getting is going to be accurate rather than information that may or may not be accurate, but is more so like rooted in personal experience. So I think that would be a great place to start. And I mean, there's Julie Smith, Dr. Julie Smith in the UK. She's like blown up and she's written a book now, but she started doing these videos in COVID, really talking about like, yeah, what are everyday like cognitive distortions that we have, and she's garnered a huge following, and I think I always recommend people to go follow her because I'm like, she's great, and she has a lot of relatable, I think, content that's really rooted in science, and and also being conscious of your engagement for the algorithm. If there's a video that you actually like, okay, I like it, comment, send it to whoever you want. But be conscious that whatever you engage with is what you're going to be sent to. So if you're engaging with more sciencey content, then maybe that will lead you in a similar direction.
Yeah, that explains why all of my content is like shit posting memes. That's all I get these days. No, but I think that that's such a great point. I mean, because the reality of social media is that it is going to continue, right? And so we have to learn ways that the science and the research and the clinical space and social media can like coexist and benefit each other in like sensible ways, right? Because they're going to have all of these things coming together. So I think that it's sound advice to sort of seek out the best kinds of sources that you possibly can and go from there. And then for somebody that's consuming some of this, like, what are some of the things that you're seeing? Is there anything that alarms you on social media in particular from a mental health perspective that you're seeing, or things that people just need to be really wary of?
I mean, I think it would probably be, if anything, from like my mental health and not just like me doing scrolling perspective. I think that we have to become, again, not necessarily like the self-diagnosis theme, but being careful of using therapy words that don't actually mean what we think they mean. Like I think, for example, I was reading an article about this not long ago too, like gaslighting, trauma, narcissist, all these words that are becoming more and more commonly used in social media, but then used inaccurately, I think also contribute to that problem of like not having shared language. And again, going through these different things of well, then does it invalidate, a situation that is more accurate to that specific word than what you're using? So I think that would be like maybe one thing. I gotta be honest, but I'm not a big social media person just because I can't last long on there. But I think that would be one of the things I would want to target more consciously with people who are active on there.
Yeah, it's kind of like the age-old challenge with the divide between like scholarship, academia, like the ivory tower, and then like how people are using language in the real world. The additional challenge that you face when you're in psychology is there's a clinical space in between those places, right, where they meet. Whereas like in my field, like we debate a lot about like what is religion and what is spirituality and like how are we defining these things, whereas people in the world are just using them however they want to and whatever feels right, and you have to respect that there's space for both. But what's interesting about your circumstance is that then they meet in this like clinical space where decisions have to be made and you're kind of might be talking past each other because of a disconnect in language that's much more significant than like just sort of like being angry from the ivory tower about people misusing the words that you're trying to define, right?
Yeah, it's interesting. Esther Perel, who's like, again, like a well-known psychologist, was talking about this recently. And she was saying there's always been, this like psychobabble or whatever, like pop culture, psychology speech. And what we used to call psychobabble, now we're talking like, we're calling therapy speak. And she was like, there's a reason that psychologists go to school for, 15 years and we're still learning like throughout our whole entire careers, because these things are very complex and it's not just like all or nothing, or, it's not just one label is going to explain everything. And I think that that really resonates with me. Like these are really complicated words to unpack, and just using them, at least within the therapy space, can be quite confusing if we don't have that shared understanding.
Yeah, and I think that's generalizable to almost every like endeavor that we have as graduate students, right? Because we're like learning the true like the specialization, like trying to narrow down our area of inquiry, where it's other people are just kind of being like science and shrugging it off. So I think that will probably resonate with a lot of our listeners, just this ongoing tension between the space in which the lay people exist and the space in which scholarship or science or these sorts of things exist as well.
Absolutely.
Yeah, amazing. So before we finish up, is there anything else you'd like to mention or talk about before we wrap up?
No, I think that's all for me. Thank you so much for having me. This were great questions and great conversation. Very excited to hear how it all ends up.
Yeah, no, thank you so much for joining us, Eloïse. And if people want to learn more about you, you said you weren't on social media all that much, but is there any way someone could reach you if they were interested in reaching out about some of your work or maybe interested in your mentorship experience?
Yeah, absolutely. I have LinkedIn, so you can contact me, Eloïse Fairbank, and you'll see I'm at Concordia in Montreal, and happy to chat further about whatever questions y'all have.
Yeah, amazing. Thank you so much.
Hi everyone, the video that you just watched is from July of 2023, 1 year ago from this posting, more than 1 year ago. And as you know, PhD Balance has undergone a lot of changes in that year. We've decided to sunset the organization, meaning we're going to be no longer posting or updating new media. However, we did have a couple of these existing interviews that never got processed and published, so we're making an effort now to go through, edit, and share these interviews with you. Our guests have amazing insight. Speaking with Eloïse was so fun a year ago, and she still, as I've listened back to this interview, had many great things to say and share with us. So we're sort of emptying the vault of all of our content. So while we won't be posting new episodes necessarily, they will be new to all of you all. So some of the episodes that we recorded last year might be coming out sporadically as we have time and bandwidth to edit and then release those episodes to you all. So thank you so much for being supporters of PhD Balance, and we look forward to sharing these great interviews with you as we roll them out. So be well, take care of yourselves, and we'll see you next time.